Have you ever looked in the mirror and noticed your teeth don't look the same anymore? Maybe they feel loose, sensitive, or you're avoiding certain foods because chewing has become uncomfortable. If you're over 60, you're not alone. Millions of older adults across America experience the same problem. But here's the good news. Losing teeth after 60 isn't something that just comes with age. It's actually something you can stop, and even reverse, if you start doing one simple thing daily. Stay with me for a few minutes, because by the end of this video, you'll know exactly how to protect your smile and keep your teeth strong for life. Now, before we dive into the fix, let's talk about what's really going on inside your mouth as you get older. Most people think it's just weak teeth, but in truth, the main reason seniors lose teeth isn't age, it's inflammation. Over the years, bacteria start building up under the gums, slowly damaging the tissue and bone that hold your teeth in place. This condition is called periodontal disease, and it affects nearly 70% of Americans over the age of 65. The scary part? Many don't even know they have it until it's too late. The first signs are bleeding gums when you brush, bad breath that won't go away, or a little looseness when you bite. But that's your body's way of warning you, and you can absolutely do something about it. The second big reason seniors lose teeth is dry mouth. As we age, we take more medications for blood pressure, cholesterol, or diabetes, and many of these drugs reduce saliva production. You might not think that's a big deal, but saliva is your body's natural defense system. It washes away bacteria, balances acids, and keeps the enamel strong. When your mouth is dry, bacteria multiply faster, cavities grow deeper, and gums become more fragile. That's why, if you're over 60, staying hydrated and boosting saliva flow is one of the most powerful things you can do for your teeth. So now you might be wondering, what's this daily habit that can stop your teeth from falling out? It's not expensive, it's not painful, and you can start right at home. It's called oil pulling, an ancient but scientifically backed practice that helps remove bacteria, strengthen gums, and keep your mouth healthy. All you have to do is take 1 tablespoon of coconut oil, swish it around your mouth for about 10 minutes, and then spit it out. Studies have shown that oil pulling can reduce harmful bacteria in the mouth just as effectively as mouthwash, but without the harsh chemicals that irritate older gums. It's simple, natural, and it works best when done first thing in the morning before brushing your teeth. But that's not all. There are 3 other simple habits you can add to your daily routine to keep your teeth strong after 60. The first is to use a soft, bristled toothbrush and brush gently in circular motions. Many seniors think brushing harder will make teeth cleaner, but that actually damages the enamel and gums. Gentle pressure is all you need. The second habit is to floss every night, even if you think it's too late. Flossing removes food particles and plaque from between the teeth where your toothbrush can't reach. And third, make sure you're using fluoride toothpaste. It's still one of the most effective tools we have to strengthen enamel and prevent decay. Now, let's talk nutrition, because what you eat plays a huge role in oral health. If you're eating soft, processed foods all the time, your jaw muscles weaken, blood flow to your gums slows down, and your teeth lose support. Try adding crunchy, fiber-rich foods like carrots, celery, and apples. They act like natural toothbrushes, gently cleaning your teeth as you chew. Also, make sure you're getting enough calcium and vitamin D every day. These nutrients work together to keep your bones, including the jawbone, strong. Great sources include yogurt, sardines, almonds, and leafy greens. And if you're taking vitamin D supplements, pair them with a little sunlight exposure to boost absorption. Let's not forget one of the most overlooked habits for oral health: regular dental checkups. I know many seniors feel anxious about visiting the dentist or think it's too costly. But here's the truth. Catching small problems early can save you thousands of dollars and years of pain later. Even if you have dentures or implants, you should still see a dentist twice a year. They can check your gums, screen for oral cancer, and make sure your overall mouth health is on track. Preventive care always costs less and hurts less than emergency care. Now, here's something that surprises most people. Your teeth are connected to your overall health. Gum disease isn't just about your mouth. It's linked to heart disease, diabetes, and even memory loss. Bacteria that live in infected gums can travel through your bloodstream, affecting other organs. That's why taking care of your mouth isn't vanity. It's a key part of protecting your heart, your brain, and your body. Think of brushing, flossing, and oil pulling as part of your daily health routine, just like taking your vitamins or going for a walk. You might be wondering if it's too late. Maybe you've already lost a few teeth or have dentures. But it's never too late to start protecting what you have left. Modern dentistry offers amazing options, from implants to gum regeneration, but prevention is always better. Even small changes, like drinking more water, quitting smoking, and using an alcohol-free mouthwash, can dramatically slow down further damage. And here's a tip that not many people know. Massage your gums for 1 minute a day. Just use your clean fingertips and gently rub in circular motions along your gum line. This increases blood circulation, strengthens tissue, and helps nutrients reach the gums. It's simple, but powerful, especially for older adults who experience reduced blood flow in the mouth. So, if you take one thing away from this video, let it be this. You have control over your oral health, no matter your age. Start your day with oil pulling, brush and floss gently, stay hydrated, eat crunchy whole foods, and never skip your dental visits. These small daily habits can help you keep your natural teeth well into your 80s and 90s. And let's be honest, nothing feels better than eating your favorite foods with your own teeth. If you found this video helpful, make sure to give it a thumbs up. It really helps the channel reach more people like you who care about their health. And don't forget to subscribe for more science-backed tips on staying strong, active, and healthy after 60. Your smile deserves it, and so do you.